This is Michelle Sullivan. Today is Friday, the last day of the 2012 San Antonio Breast Cancer Symposium. We're finishing up by asking, what did you learn this week that will change the way you work?
There are many, many things in the pipeline, so there's so much more coming. And at this specific meeting, there were about 20 posters. There were 15 lectures that gave information directly on triple-negative breast cancer, so that those of us that are advocates in that area, and for me specifically, I can say there's a lot coming in the future. Watch for trials so that you can recommend to patients who need it that they can go into trials.
There is very interesting information about the trial of long-term tamoxifen use for 10 years instead of 5 years, which turned out to be better, much better than 10% difference instead of giving it 5 years, and it will be, I think, a very important thing for our practices. The rest is just beginning to evolve, and it's not really practice changing yet, but we'll be waiting for more news.
So did you learn something at the meeting that you really think is going to be changing practice at some point?
Certainly. I think the hypofractionated radiation, shortening treatment intervals from 5 weeks to maybe as short as 2 weeks is going to be practice changing in the U.S. as it has been in the U.K. I think that'll have a lot of ramifications for my patients in terms of ease of getting to radiation, tolerability of the therapy, effectiveness of the therapy. I think that's going to be the biggest immediate impact.
One of the talks that I found compelling was the talk looking at changes in brain activation regions based on chemotherapy exposure or not having chemotherapy. And I think it changes some of our perceptions of what chemotherapy actually does to the brain. And it turns out a lot of women going into that phase of therapy already have pre-existing injuries, so to speak, that does worsen over the course of chemotherapy. But I think that really changes our assumption that it is all really chemotherapy.
Do your patients, when they experience this, does it worry them? Do they think something's really going wrong with them?
They do, absolutely, and it's a constant concern, and it takes a lot of reassurance on our part. The good news is over time, many patients do experience recovery. It just takes a really long time. But especially in that first year after therapy, it's a real struggle with a lot of complaints about memory and cognitive slowing.
That's all for us. We'll see you in 2013.